Slipped capital femoral epiphysis. Slipped capital femoral epiphysis. The risk factors are obesity and adolescence. Clinical feature: dull hip pain, referred knee pain, dull hip pain, referred knee pain, limited internal rotation of the hip, limited internal rotation of the hip, and altered gait. So dull hip pain, referred knee pain, dull hip pain, referred knee pain, altered gait, and limited internal rotation of the hip. Diagnosis: in here there is posteriorly displaced femoral head on X-ray. In slipped capital femoral epiphysis, there is posteriorly displaced femoral head on X-ray. Treatment is non-weight bearing and surgical pinning. Non-weight bearing surgical pinning. In slipped capital femoral epiphysis, complications are avascular necrosis and osteoarthritis. This slipped capital femoral epiphysis can happen bilaterally too. The differentials of the slipped capital femoral epiphysis, it may be ileus was bursitis, where there is inflammation within the bursa posterior to the ileus was muscle due to overuse or trauma. In here, patients have hip pain, limited range of motion, and palpable click with manipulation of the hip is typically present. So, hip pain, limited range of motion, and a palpable click with a manipulation of the hip is typically present. Children with endocrinopathies like hypothyroidism often have slipped capital femoral epiphysis at an earlier age, less than 10, and are more likely to develop bilateral disease. So endocrinopathy may be another risk factor for having slipped capital femoral epiphysis in the earlier age before adolescence. So obesity, adolescence are the risk factor along with the endocrinopathies like hypothyroidism. That's all.